Hi everyone, this is why children should be required to receive vaccines. I would like to begin by showing you that I am in fact wearing shoes. I know that you can't necessarily see them in the video, so I wanted to show you that I am in fact wearing them. Thank you. So I'd like to begin with children should be required to receive vaccines in order to protect others. Vaccines can provide children with immunity to diseases, protecting themselves as well as others. According to the Centers for Disease Control, vaccines reduce children's vulnerability to diseases by working with their body's natural defenses to develop immunity. The two means of acquiring immunity to diseases are through either vaccinations or contracting the disease and fighting it off. As stated by Paul Offit and Charlotte Moser of the Children's Hospital of Philadelphia, vaccines provide the immunity that comes from natural infection without the consequences of natural infection. When a child acquires a disease, they obviously experience symptoms. These symptoms can include, but are not limited to, a fever, cough, or runny nose. Therefore, when children acquire immunity to infection through vaccinations, the means are much safer opposed to receiving immunity from the contraction of the disease, receiving symptoms, and fighting it off. According to Dr. Daniel Bronfman, pediatric doctor at the Ochsner Hospital for Children in New Orleans, the hepatitis B vaccine has a 90 to 95% efficacy and preventing acquisition of this disease for at least 15 years from immunization. A single vaccine can protect a child from acquiring hepatitis B for approximately 15 years, thus showing why vaccines are so important in protecting children, not only during childhood, but for years to come, specifically 15 years when considering hepatitis B. According to Dr. Gordon Boone, family physician for over 35 years, vaccines are not only beneficial to your child, but all children that your child comes into contact with. Vaccinating a child ensures that there is little risk of disease contraction among other children in settings such as public school. Therefore, the decision to vaccinate your child protects not only the child that receives the vaccination, but also the individuals that child comes into contact with. Vaccines are not solely intended to protect one individual child, but instead they are designed to protect other children and adults from contracting diseases. Next, I would like to talk about why children should be required to receive vaccines in order to manage outbreaks. With the immunity acquired through vaccines, children become incapable of acquiring diseases, therefore decreasing the number of outbreaks. According to Dr. Omer, high immunization coverage has resulted in drastic declines in vaccine-preventable diseases. With more vaccinated children circulating, preventable diseases are more likely to experience a decline, since increasing numbers of children have acquired immunity. As stated by the Committee on Infectious Diseases and American Academy of Pediatrics, the eradication of preventable diseases, such as smallpox, serves as a model for fulfilling the promise of disease control through immunization. The utter destruction of a preventable disease due to the work of vaccines is the epitome of disease control. Therefore, it is safe to conclude that vaccines manage the potential for disease outbreaks by simply lessening the number of possible hosts for that disease. And lastly, children should be required to receive vaccines in order to decrease public costs. Vaccines can help decrease public costs associated with the treatment of vaccine-preventable diseases. Vaccines can lessen the circulation of diseases, thus decreasing the overall medical expenses associated with the treatment of these diseases. Vaccine programs have the potential to cut individual and public costs associated with the treatment of preventable diseases. The Committee on Infectious Diseases and American Academy of Pediatrics cited that since the administration of the rotavirus vaccine was recommended routinely, the number of hospitalizations involving this disease has decreased dramatically. Once the rotavirus vaccine was routinely received by individuals, the subsequent hospital stays associated with the treatment of the disease experienced a decline. Obviously, with decreased hospital stays, a decrease in medical bills for said hospital stays would occur as well. As for the public economy, vaccines have the ability to revert enormous sums of public costs. In a report published by the CDC, findings suggested that vaccines will potentially avert $402 billion in direct costs and $1.5 trillion in societal costs because of illnesses prevented. Vaccines have the potential to save millions upon billions of dollars due to the prevention of illnesses, therefore decreasing the number of hospitalizations, doctor's visits, and medications prescribed in association with preventable diseases. Clearly, vaccines have the ability to prevent additional costs to individual families and the economy as a whole. Thus, in conclusion, children must be required to receive vaccines in order to protect others, manage outbreaks, and decrease public costs. It only makes sense. To protect societies around the world, we need to require children to receive vaccinations. Thank you.